Can I talk about withdrawing care on a patient? Absolutely. In the ICU, we deal with the sickest of the sick people. And so a lot of these patients do end up getting better, but a lot of these patients do not end up getting better. And then we are in a position where we need to make some big decisions. So we withdraw care or remove life support or terminally extubate, compassionately extubate. All these different terms all mean essentially the same thing on patients quite a bit. When I was a brand new itty bitty baby ICU nurse, only 22 years old or so, this was something that was really intimidating for me. And as I have grown into my role and gained more experience throughout the years, withdrawing care and comfort care patients are probably one of my most favorite types of patients to take care of, because I feel like it's nursing in its most raw, beautiful form. We do so many things to people in the ICU, knowing that they are ultimately not going to get better. But when we put someone on comfort care, it's like we are doing things for this person. We are allowing them to be comfortable and peaceful, and I love supporting the patient and their families. But enough about that, let's talk about it. First things first, before you even withdraw care on a patient, remove any sort of life support, we need to have a couple things in place. First is everybody needs to be on board. A provider needs to have had a conversation with the patient and the patient's medical power of attorney and anyone who's involved in any decision making for that patient about what the situation is looking like, and the family and patient need to all be on board with the fact that we are going to be removing life support. You need to have a DNR order in place and an extubate order in place if your patient is currently intubated. You also need to have orders to stop everything and a set of medication orders that we can give the patient should they appear to be in any pain or distress or have any anxiety. You are also going to call your state's donor network team prior to removal of any life support. This is a mandatory thing for nurses to do prior to removing any life support. This isn't the organ donation team wants to come in and swoop up all the organs. It's not about that. It's about identifying patients that potentially may be suitable organ donors and allowing that patient the opportunity and the family the opportunity to choose organ donation should they want it. So once you have all your ducks in a row, the patient / medical power of attorney have chosen to withdraw care, you've got your orders in place, you've called the donor network team, this is a time where we can go in and start the removal of care process. I like to make sure I am super educating families along the way through this process so there's no confusion when we get to this point. I like to explain to the patient and family, like, hey, the ball's in your court. I'm not in a rush. When you guys feel ready, let me know and I will come in and the respiratory therapist will come in. We have some medications that we will give the patient prior to taking out the breathing tube. That way they're comfortable throughout the process. And then we'll go ahead and give those medications. We're going to remove the breathing tube and we're going to shut off any of the drips. You want to make sure if your patient's hooked up to a monitor that you silence all of the alarms. A lot of the monitors can actually be put into like a comfort care mode where things will not alarm, so it's not being distracting and distressing to the families. I always ask the families if they want to stay before we remove the breathing tube. Some of them have a really hard time like physically seeing that breathing tube come out, and sometimes they don't want to leave the patient. So I always like to offer that to them. Oh, and I forgot to mention, if you have a chaplain at your hospital, I always offer the chaplain, even if the patient or family is like, no, we don't want it. I always like to just let them know that it's there in case they feel the need for that or they want to be connected with like their spiritual clergy. So we gave the comfort medications, pull the breathing tube out, we've stopped all the medications. Now the focus is going to be to keep your patient comfortable throughout the process until they pass away and or get transferred off of your unit. If a patient's imminently going to pass, we will keep them in this ICU room and we will allow them to pass away, and then we'll do all of the post-mortem care and steps that come after a patient passes away. If you want a video on that, we can talk about it. If a patient is taking several hours to pass away, then we will most likely either transfer them to their hospice facility of choice if that is already arranged and in place, or to transfer them to a med-surg floor because we are no longer providing ICU level of care to this patient. But I think I've covered everything. This is a topic I'm like super passionate about and I love talking about, so feel free to ask me any questions because I'm happy to talk more about it.